Epidemiology tells us that a lot of young women in the childbearing age period from 15 to 35 nowadays are overweight or obese. Does this have an effect for the next generation?
That's a really interesting question. We know that obesity coming into pregnancy is associated with a number of adverse consequences during pregnancy. We also know that there's an association between maternal obesity and obesity and other consequences in the child. The big question is whether that's mediated through mechanisms that are occurring in utero, or whether it's just because the child inherits genes from the mother or grows up in the same household as the mother. And we might include the father in that as well.
Now, interventions. If the mother, the young woman, before becoming pregnant or during pregnancy is on a fitness program, increases physical exercise, or takes care of the diet in a very targeted way, is there any effect on the child?
We don't really know if there's an effect on the child yet. We're just in the era of starting intervention studies during pregnancy. There have been a number now that have been published on gestational weight gain, on treatment of diabetes, and they seem to have some effects around the time of birth, but whether they're lasting into childhood is really not known yet. It's really important to follow up the children from these trials to see if there are effects.
Gestational diabetes, is there, if it's treated well, is there effect? Or can't we say it?
There are two major trials of gestational diabetes treatment, one in Australia and one in the US. They were both large, they were both very well done. They both showed decreases in the frequency of large babies, and we thought that would translate into the decrease of large children. But in one subset of one of these trials, we could not show it. That may be because there is a trajectory of growth in offspring of diabetic mothers that's at a nadir around 4 or 5 years, which was the outcome age of that trial. There could be other explanations. So we need larger follow-ups.
And weight gain during pregnancy, can it be influenced by any diet?
Yes, there are now new studies coming out that suggest that weight gain during pregnancy can be altered by intervention. We don't know exactly what the magic trick is, because one of the largest studies done in Australia did not show a change. It may have a lot to do with the intensity of the treatment and the adherence. This is what we find in treatment of obesity in non-pregnant adults.
So, long way to go, as it seems. There seems to be a lot of evidence, but when it really comes to clinical trials to prove the evidence, there's very little there.
There are animal experiments that date back decades that show that changing these risk factors and other pathways during pregnancy can have an association with offspring metabolic consequences. We have now a bevy of observational studies that suggest these associations. But to know whether it really works, we need the follow-up of the randomized controlled trials. Those are expensive, they're difficult to do, but they're really necessary.
Thank you very much.
Thank you.
Thank you.